Hey guys, this is Kevin Budashevsky, and this is G6PD deficiency. So you guys may or may not have already covered the video on the HMP shunt, but if you haven't, I would recommend seeing this prior to this video. So what is the important function of the irreversible oxidative reactions of the HMP shunt? Well, it essentially makes NADPH. The enzyme G6PD is involved in both the HMP shunt and the respiratory burst. It plays a key role in regenerating NADPH. So let's say we have a substance that's harmful to the body, like hydrogen peroxide. It can cause oxidative damage to the body if it's not dealt with, so what will our body do to protect itself? Well, the body will actually use a reduced form of glutathione to neutralize the hydrogen peroxide to water. However, to keep high supplies of reduced glutathione available, the body needs a lot of NADPH. And where did I say we got our NADPH? The HMP shunt. If we're missing the key enzyme G6PD of the HMP shunt, then we cannot make enough NADPH and our bodies can be subjected to oxidative stress without being able to appropriately deal with it. What is this? Well, this is an almost guaranteed test question. The boards absolutely love this enzyme and frequently test on G6PD, so I'd pay close attention to this video. G6PD is actually the most common human enzyme deficiency. It is X-linked recessive. One of the main problems in G6PD deficiency is that it prevents the reduction of glutathione, which makes cells much more susceptible to oxidative stress. Under normal conditions, patients with G6PD deficiency might not have symptoms, but when subjected to oxidative stress, such as things like drugs or inflammation. Drugs can be sulfonamides, nitrofurantoin, primaquine, or isoniazid. It results in stress that ends up resulting in hemolytic anemia, where the red blood cells can't handle the stress and will lyse. These patients should also not eat fava beans since they contain high levels of oxidants. However, none of these are the most common cause of hemolysis in G6PD deficiency. Can you guys guess what that might be? So in other words, what's the most common cause of oxidative stress that the body experiences? That would be infection. Good. On test day, make sure you focus on the information provided. If the question depicts a black individual who is taking a new medication and develops hemolytic anemia, you should immediately think G6PD deficiency. With so many negative side effects of G6PD deficiency, are there any positives to having the disease? Well, the only silver lining is that it provides some resistance to malaria, possibly by causing higher levels of oxidative stress. How else could you be tested on G6PD deficiency? Well, one of the ways the boards likes to present this is by showing this, which is a depiction of bite cells. These are indicative of G6PD deficiency, and they're red blood cells that have bites taken out of them. So why in the heck would phagocytes bite off part of red blood cells? Well, in normal individuals, NADPH serves a protective antioxidant role to the red blood cell. If you aren't able to produce NADPH because of a G6PD deficiency, you aren't able to regenerate the reduced form of glutathione, which protects the cell from hydrogen peroxide damage. So when you can't protect the cell, you get damage to things that are inside of the cell. So in the case of red blood cells, what's mainly inside of it? Well, that would be hemoglobin. So you get denatured hemoglobin that precipitates within the cell. So this denatured hemoglobin is called a Heinz body, and these occur during times of stress. Phagocytes recognize these Heinz bodies in the red blood cells and bite off pieces of them as the Heinz body accumulates. Although knowing the contents of the Heinz bodies isn't extremely high yield for the USMLE Step 1, being able to recognize the significance of them on a peripheral blood smear is absolutely essential. So on test day, immediately think G6PD and NADPH deficiency, although other things like thalassemias and asplenic patients may also exhibit Heinz bodies for the same reason, and should be part of your differential diagnosis.